Hello, my name is Jose Morel, and I'm here to present my poster. The topic I chose was integrating a cognitive behavioral therapy enhanced clinical pathways into type 2 diabetes care. I partly why I chose this topic, it's personal but yet meaningful to me to discuss. I've had a long family history of diabetes in the family that has come along with other health complications. And so, in addition to that, as a clinician utilizing CBT, I thought this made a lot of sense in terms of presenting. So, CBT, as you know, is an evidence-based practice that generally resonates with me, but it's also utilized to change any type of maladaptive thinking and helping to replace that with more welcoming thoughts, and less distressing thoughts. And so I want to talk about diabetes type 2 here. So, what is diabetes type 2? So, it is a chronic medical condition in which the body has too much sugar, also known as glucose. And so the body doesn't respond well to insulin, and so also known as insulin resistance. And so the pancreas does not make enough insulins to keep a healthy blood sugar level. And so let's talk a little bit about the background. So, in regards to background, managing type 2 diabetes requires daily decision making, coping with stress, and self care. There's also unhelpful biases and low motivation, distress, and other factors that could be quite sabotaging for clients in terms of maintaining adherence and compliance with treatment. So there needs to be ongoing education efforts on diabetes that are often oriented towards knowledge rather than addressing barriers to thoughts, emotions, and behavior. So CBT does offer a structure, evidence-based approach to addressing some of these concerns or some of these obstacles or some of these barriers. And so it makes individuals, so I feel that it makes it a strong candidate for integration in diabetes care. So um, also methods that are utilized. So, there are screening tools that are utilized, such as PAID and DSMQ, to screen for behavioral issues. Also, it's important to, if you're working in a setting that has integrated care, is arrange a warm handoff, primarily to a clinician that already is trained in cognitive behavioral therapy. And this is something that, as I mentioned, resonated with me in view that I've done some intensive training through Boston University on cognitive behavioral therapy, and I found it really helpful in terms of helping to address any distressing thoughts, unwelcoming thoughts, negative distortions, or any unpleasant thoughts, and really just helping clients utilize healthier adaptive thinking to help yield better positive results or positive outcomes. And so, providing a 6 to 8 structured cognitive behavioral therapy session that covers cognitive restructuring is important. Also, it's important to kind of give ongoing encouragement and reinforcement, especially during regular doctor's visits. Results. So let's talk about results. The results, as I've seen, is that it does allow for improved medication adherence and glucose monitoring consistency. I worked on a team, it was called TLC, and this was through a community health center, also a federally qualified health center, where we had established a team of interdisciplinary team members that included a behavioral health provider, a nurse, a nutritionist, a doctor, a case manager, and then also a community health worker. And through this collaboration, we were able to really identify those patients with hemoglobin A1Cs higher than 8.0. And this really helped us to really work with these clients and really help to get these levels down and help manage their care. So we did see a reduction in diabetes distress, increase also, the goal is to increase self-efficacy and help clients feel like they're more in control of their blood sugars, establish more self-sufficient autonomy, independence, and self-management with their care. We also, the goal was really to kind of see A1C improvements of approximately 0.4% to zero point 0.8 within at least a 3 to 6 months period. In addition to that, the literature really highlighted some fine points, indicated that CBT does in fact improve adherence. It helps reduce distress and supports glycemic control. Integrated behavioral health models really increases engagement and reduces care fragmentation. So ADA standards of care emphasize psychological assessments and behavioral interventions as part of managing this chronic condition, and sustainability and scalability are improved by structured pathways that are team-based. So I'm kind of looking at a CBT enhanced diabetic care workflow. We look at screening, which is the number one step, doing a warm handoff to a behavioral health provider, having that behavioral health provider do a structured CBT session. We also want integrated education, right? I talked earlier about the team of nurses and professional staff and making sure that clients are gaining diabetic education and awareness on how best to manage and treat diabetes. And then reinforcement and making sure um, that clients are following through with treatments and that making sure that they are coming in for their follow-up visits. Some discussion points. And so, in regards to discussion, is that incorporating CBT into the care of a diabetic patient really addresses the emotional and cognitive barrier to self-management. It reiterates how mental illness is important as physical illness in the diabetes patient. So remember, your physical health, your mental health is just as important as your physical health. Primary why I highlight here in the image, mental health matters. The warm handoff strengthens engagement and reduces stigma, and so really integrated behavioral health has been great because it really allows the behavioral health provider to be identified as a team member, really helping to address some of these concerns. And so it sort of reduces that stigma or that taboo of seeking behavioral health services. Also, improvements in A1C distress. As I mentioned previously, self-efficacy is important and are consistent with the literature, and suggesting that a structured CBT session can really lead to improvements in behavioral health and clinical outcomes, especially for adults with type 2 diabetes. The project really focuses on a replicable, evidence-informed model of connectedness between behavioral health and chronic disease management to be applied in research on digital delivery and long-term sustainability and wider implementation. I thank you for listening to my presentation, and thank you so much, and have a great day.